Hi, and I'm Dr. Terry Willard. I'm a clinical herbalist. I've been in clinical practice for over 40 years, and during that time I can say, whoa, has it been an adventure, to say the least. How did I start? Well, I actually started way back when in the 70s living in a teepee. Yes, I was one of those hippies, but I wanted to learn more about how plants could communicate with us. So I started doing that after my bachelor's of science. And then during that period of time, I realized that I had an affinity to the plants. And so I worked further onto that to go up to get a PhD in health sciences. After that, I started a clinical practice in Calgary, Alberta, and have had clinical practice in Hong Kong, Vancouver, and in Calgary, and all across the country as a traveling show, as it were. Herbology has been my life, to be able to work with the plants. I like to spend a lot of time outside. I love the concept of a 100-mile diet, but I'm lucky enough to live on Vancouver Island, and we have a 23-meter diet, basically, because we live a sustainable lifestyle, being able to produce most of our food ourselves on our little farm on Vancouver Island. Herbology is, well, to me, the quintessential health program. Why? Well, we've been doing it since we were a species. That goes back almost 2 million years. That we've used herbs as our major form of medicine. A lot of people say, well, that was in the past, but the World Health Organization says that herbal medicine is used by clearly 80% of the population today. So living down this idealistic cul-de-sac educational system of science that we have in the Western world, we forget what the rest of the world's doing. No, it's not because of superstition. It's not because they can't afford it. They do it because, well, it works. That's important to note. What's the biggest difference between allopathic scientific medicine and herbal medicine? Well, it's easy. In one word, it is life. What do I mean by that? When I'm taking a herb, I'm not just taking the convenient biochemical factory in there as a delivery system. I'm also taking on the vital energy of the life that's been in the herb itself. When I take a pharmaceutical, I'm taking a dead chemical that might deliver me some chemicals, but it doesn't deliver me life. What does that mean? Well, it's kind of like if I was working in the vanilla world of science, I was getting a machine like a car. But if I'm working in the herbal world, I'm getting maybe a Tesla. That's cool. But I'm getting the family that's in the Tesla too. So I can join the community of the life energy that works in it. So herbal medicine works with the natural biochemical, bioregional, and life energy that's in our body. Whereas the pharmaceuticals don't have to do that. Now don't get me wrong, I'm not against science. Heck, I have a PhD in science and I like it a lot. But sometimes it's missing things. As I pointed out, sometimes science is, well, too vanilla. And I like to celebrate the ethnic diversity of our country, of our world. Sometimes I like to go to ethnic restaurants and find more flavors. That's what you're going to get with herbs. You're getting more nuances of life energy with the botanical remedies than you do with the science. So yes, you can go to science for fast food, but that's what you're getting. If you want to really enjoy your life and savor it, and take in the aromas and the flavors of it, use herbal medicine. Because herbal medicine gives you life, doesn't steal life like pharmaceuticals. So I'm kind of passionate about how herbs work. I've been using them for a long time, and I've worked with literally tens of thousands of patients. No, we're not just talking immune systems and coughs and colds. We've had very good success in all kinds of the clinical critical problems like cancers and autoimmune diseases and allergies and things like that. So botanical remedies can be able to work with you on an individual basis. So after traveling this journey for over 40 years of working with patients, I still feel that botanical remedies are the best way to give an individual help. In acute emergency healthcare, I'm suggesting you might want to use the pharmaceutical and the scientific medicine. But for the long, slow, comfortable thing, you want to use the botanicals.